I learned about the difference between rational and irrational use of medicine.
Care provided. How can you do the thing which the parents can't do? Excellent.
Some of the people use medicine without any prescription of doctor.
Pharmacies should not be allowed to give medicine without the prescription of the doctors.
I learned it is dangerous for everyone to take medicine.
Most of the people take drugs to overcome stress and pain. What are the side effects of this?
Can you please describe its use?
Which can be positive as well as negative.
What do you mean by use of appropriate antibiotics?
My question is that nowadays people are using antibiotics like...
Nowadays, why mostly people depend on medicine, whereas
if a person is taking drugs and he wants to come out from that disease, what is the best method to come out from that disease?
What do you mean by that, and how it can be dangerous for us?
They are treating in our colonies, in our villages like a doctor.
Bad companies and bad friends. I also noticed this in my surrounding.
Today's session was really beneficial for all of us, and I came to know that we shouldn't take antibiotics without prescription.
What is your opinion about this?
It was very nice, mashallah.
So I came to know about medicine and drugs.
Confidence for asking questions.
Today's session is very helpful for me.
I came to know about the uses of omeprazole. Her presentation was very amazing. I learned a lot of things, but one thing which I learned that if a person is suffering from...
Don't take medicine without the description of...
I came to know about the illegal factors that are connected with medicines.
As I am the part of medical team, I came to know the different views of non-medical person about medicine, and also I came to know many things related her research regarding medicine and their rational views.
Which medicine he needs? أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم. Dearest young scholars, how are you?
We are fine.
This is our third session. The first session was the presentation was given by Snoba, and it was the great Mr. Osama, who gave an ideal presentation on the most needed topic, that was
entrepreneur.
Yeah, I request my beloved daughter Sumaira to please come at the dais and enlighten us with your thoughts. Now, you ready?
Yes, sir.
First of all, it's you to listen to the lady for 2 minutes. As her 2-minute talk is over, it's you to ask the question, but keep in mind that the question is supposed to be coined before you stand up. It's you to coin the question, not during her talk. Just take out your notebooks or the diary or register or some other paper. Even you can use your mobile phone for taking notes now. So your question should be in the written form in order to make it more meaningful, more accurate, and it will save our time as well. So you're ready? You're ready?
Yes, sir.
Your time starts now, please.
Assalamu alaikum. Today I am going to speak on the topic rational use of drugs. As today's world is about more diseases are discovered or diagnosed, so we all use medicines at some stage of life whenever we feel unhealthy or some serious diseases. Rational use of drugs means that patient receives appropriate amount of drug and in appropriate doses related to disease conditions which are appropriate or correct for patient's needs. The irrational use of medicines is a worldwide problem. As I was going through a research study or survey which was conducted by World Health Organization, that was about irrational use of medicines. According to an estimate that about half of the patients are failing to maintain their medication doses according to their needs, which results in poor results. For example, increased use of prolonged use of proton pump inhibitors. For your knowledge, I'm giving the example of omeprazole, which is commonly used in our households. The elderly patients use omeprazole for a long period of time without taking any interventions or counseling from doctors. The result is other side effects like increased risk of fractures and some vitamin deficiencies. Another example is inappropriate use of antibiotics, which results in resistance to antimicrobials. Means that antibiotics start resistance. There is no effect of medicine in over diseases, which is due to inappropriate use.
Sorry. So we are going to start the question answer session now. You are ready for taking the questions now? The first question, please.
You have mentioned a medicine Nebrazol. Can you please describe its use?
Sorry, beta. It's you to paraphrase the question in order to make us understand. Please.
She is asking about some information related to medicine called omeprazole.
Yeah, please.
Omeprazole, in layman language or simple language, we can say that omeprazole is medicine which we use in acidity, heartburn or stomach ulcers.
You use two terms. What were those? Two kinds of the problems which you
stomach ulcer and heartburn.
What do you mean by that?
Heartburn means that patient feels that something is going upside from stomach, and he feels uncomfortable, irritated.
Yeah, please, question.
Most of the people take drugs to overcome stress and pain. What are the side effects of this?
Excellent. The question, please. Please paraphrase the question.
He is asking about that most of the people take medicines to relieve their stress and pain.
Okay.
So what are the side effects?
Side effects, yeah.
Every medicine has side effects. So one thing is needed, that first of all, before using any medicine, consult with your doctor and pharmacist. Side effects of medicines which are used as antidepressants, we can feel some stomach problems, and dementia is also related to use of antidepressants, which is more prominent, as memory related problems are common in people on prolonged use of antidepressants. And while the other hand, painkillers are concerned, most of the people feel ulcers and joint diseases as well as kidney problems are concerned with.
The question you just responded to was about the side effect.
What is meant by side effects?
Side effects are other than pharmacological or desired effects, which can be positive as well as negative. For example, for a better understanding, when we use iron supplements for anemia, there is a complaint that most of the people fear that after taking the medicine, our stool color becomes darker. Yeah. So that we have some serious issues with the medicine. When they come towards us that what is the main problem or issue related to medicine, we guide them that it is normal to have stool color darker, because the medicine has color in ingredients, and whenever we eat, we take the medicine, and the color of stool changes. It's normal.
Yeah, please, question.
If we talk about our society have no knowledge about medicine. Some of the people use medicine without any prescription of doctor. They rely on only pharmacies, and those people who have had a category B without having a proper knowledge about medicine and their side effect. So how we educate those people to use proper way of medicine and prescribe medicine by a doctor?
You are against self-medication. Yeah, please.
Discuss that self-medication is more common in our society, that most of the people rely on category B medical stores, and they don't prefer to go to the doctor for their diseases. It is more common due to many reasons. As far as I noticed, some reasons that are due to poor socioeconomic status. Many people prefer to go to the medical store, and they discuss with the concerned person their problems. They want to save their money. They do not prefer to go to the doctor. That doctor is prescribes a list of medicines, or he before prescribing he suggests a number of tests, and they are preventing those things. On the other hand, practitioners trend is so much common in our society that even the place where I live nowadays, people come towards me that please suggest me something, and whenever I ask them to go to the doctor, that your disease condition may have some complications, they are reluctant to follow the instructions. They give an example that Mr. ABC is giving medicine in only just 30 rupees, and you have only prescribed a medicine which have so much cost, and if I go towards the doctor, he will suggest a number of tests, and after when he diagnoses my problem, the medicines will take also so much cost. So I cannot afford that.
That is the reason. Please.
In your conversation, you use two words, appropriate and antibiotics. If I use them together, what do you mean by use of appropriate antibiotics in the life?
Please make us understand now the question now the man just asked. It seems
wants-
to be very meaningful, no?
Yeah. He wants a discussion on about the use of antibiotics. That what is mean by appropriate use of antibiotics.
What is meant by?
Meant
What
by.
is meant by
What is meant by
appropriate use of antibiotics? Yeah.
Antibiotics are medicines which we use for diseases related to infections. Appropriate use means that whenever an antibiotic is prescribed, the physician knows the better condition or the related organism, causative organism which cause the specific infection. But in our society, the practice is common that a person is prescribed a medicine whenever he feels better. For example, if the medicine is prescribed for 5 to 7 days, means you have to take the medicine for specific number of days, irrelevant of the fact that you are feeling better after taking 1 or 2 doses. But the practice is common that people reject to accept the counseling sessions that I am feeling better, that there is no need to take the medicine for a specific number of days, which results in resistance. Means the causative organism, when receives the medicine in low doses, he becomes resistant. He becomes used to that chemical. Results in antibiotic resistance. So on the other hand, it's common practice that if I feel better, for example, I'm having a sore throat and a doctor prescribed me a medicine. Whenever the other person feels the same condition, I will suggest him or her on my own choice that please use this medicine, it's very effective. But it may be the person having a sore throat can have other complications which are causing them to feel sore throat. So we should think about these aspects.
She has a lot of knowledge. I want to know so many things from her, because the time is not there, so I'm just skipping. Question, please.
My question is how the ratio of irrational medicine using in Pakistan according to the survey of World Health Organization?
Excellent. How much?
His question is that Pakistan at individual level, at country level, what is ratio of irrational use of medicine?
Irrational. Please, rational use and irrational use we will discuss later. Actually, I have so many questions in my mind which I would love to ask, if you are not asking. Rational use and irrational use. See, please.
I do not have the exact figures, but it is estimated that around about more than half of the medicines which are prescribed are sold or dispensed irrationally, and on the other hand, more than half of the patients which are taking medicines take medicine in inappropriate manner, which we can say that irrationally.
True, but the exact proportion, the number, the percentage, that's not in your knowledge. Okay, please.
My question is that nowadays people are using antibiotics like Augmentin and Athrocin if they have very little fever or sore throat. It is good or bad?
You are talking about specific, two specific medicines, and with specific, that disease.
According to my knowledge, the conditions like flu and sore throat, these are caused by viruses. A group of viruses, but the common trend is we use antibacterials, means the medicines which kill or control the growth of bacteria. One difference is this, and the other is that this practice is not rational, as fever or flu should be controlled first with the help of food or diet management, and you should have take warm water and the diets containing vitamin C. But in our society, whenever I suggest someone that first try to control your conditions with this and that, they are reluctant to follow that. They say that please suggest us some sort of medicine which we feel better in one day. That is not possible.
Rapid recovery. Please, thank you. Food management. So these are the things actually it's you to ask the question about in the next round. Whenever she gives answers, she uses different ideas. For example, the first question should have, ma'am, what do you mean by that rational rational use How can we come to know that this is the rational use Clear? And what is the standard of that rational use When that how can we say that this food is irrational? Or this is that irrational use of drugs. Whatever the answer she gives, she uses number of terms, number of concepts. So it's you to ask the question about those points so that we can make the concept clear. Now you got the idea? The first point, the second point, the third point. Whenever she gives answer, know that in that answer there will be something new. Question, please.
Nowadays, why mostly people depend on medicine, whereas in past people are opposite of it?
Paraphrase it.
His question is that nowadays people prefer to take medicines as compared to past, in which people use diet or other strategies.
So don't use that word as compared to. We discussed all these things in the previous sessions. This is compared to, not as compared to. Compared to. So there is a comparison between two generations. The current generation that goes for what? Treatment. I mean medicine, drugs, etc. Whereas the people in the past, I mean our forefathers, they used to depend on food. This is they didn't go for medicine most of the time. Their first choice was not medicine or drugs. Their first choice was food. But nowadays the first choice of the people is medicine. And the question is why? Excellent, please.
The people of modern world has more awareness related to diseases and as well as medications. And the people of past were more simple, and the diseases were also not discovered at advanced level. So this can be the reason, and the other reason is that people in the past were more resistant to diseases or had an immunity level were very good as compared to people of today, because our lifestyle and our dietary patterns are so much we can say modernized that we do not prefer to stick toward the healthy diet. So there is a reason that today the disease complications are so much advanced that all of us has a fear that the disease is the concerned disease can harm me in an advanced level. So we try to cover that aspect with the help of medicines.
Excellent. Thank you, beta. Really very impressive answer. Please.
If a person is taking drugs and he wants to come out from that disease, what is the best method to come out from that disease?
His question is more toward the side of narcotics use. That how can a person get rid of that habit?
That was your question?
Yes, sir.
If a person wants to get rid of that habit, according to my knowledge, one should have to consult the institutes which are taking care of persons having addiction related problems. And the other thing is that try to taper off the targeted medicine. For example, if you are addicted to alcohol or you are addicted to some medicines such as diazepam is a medicine which is relaxant, as well as people use it in some other ways. If you want to get rid of this habit, taper off your medicine. For example, if you take I'm going to give this example just for understanding. If you are taking 1 or 2 tablets per day, or try to taper off such like that, try to reduce the dose. If you take 2 tablets per day, try to recover yourself, try to satisfy yourself on less number of tablets. For example, 1, then half, in such way. It is the best strategy, but it can result in tremors, and patient feels that he is going to die. So there are a number of strategies.
Thank you. Please.
What's the reason of using drugs?
What does he want to know?
He want to know the reason behind addiction to medicines or drugs, or what are the causes or reasons behind their act.
Please.
There can be a number of reasons, such as depression, anxiety in daily life routine. On the other hand, bad company. People are encouraging someone to take or to get addicted from this for fascination, just to synchronize their habits, so-called modern world with the modern world. So and there is lack of awareness, and when someone is ignored from family, he tries to get attention, or he tries to fascinate him or herself to get rid of those problems at mental level. So people try to go in the world of imagination, which leads to addiction problem.
It's really impressive. I do agree. Thank you. Question, please.
What are steroids and its uses, and how it is harmful to our body?
That what are steroids and what have their side effects?
Very good. Please.
Steroids are a group of medicines which are related to hormones, and they have a lot of uses if used in proper or cautioned way. For example, steroids have anti-inflammatory effects. And we use in inflammatory them in inflammatory and autoimmune diseases. Autoimmune diseases are those diseases in which our own body recognize our body cells as invaders, and our own body is a defense mechanism to start destroying our own body cells. As far as I know, that steroids are used for bodybuilding and these type of purposes, but their use is restricted due to a lot of reasons. Due to unauthorized use, it can lead to reduced immunity levels, which can result in a number of related diseases and infections.
You just said unauthorized use. What do you mean by that?
Unauthorized use means that our drug regulatory agencies has a control on the use of steroids to avoid its irrational use.
Immunity level, what's that?
Immunity level is our natural defense system, which controls the entry of unwanted foreign particles, or you can say that germs.
Is it harmful or beneficial for our body?
as every medicine is a poison if it is used in excess. Same is the case with steroids. That some people use as a self-medication. It is not good.
Yesterday, one of men who was sitting with my father talking about steroids, he told that my daughter was involved in kidney problem. She was suffering from kidney problem, and a doctor, all doctors said that she is near to die. But one of doctor in Lahore prescribed 4 to 5 steroids in morning and 4 to 5 steroids in the evening. And she is now she's okay. Yeah, she is okay and living a healthy life now.
Interesting.
That is a rational use. That can be according to her medical conditions or complications, as these are anti-inflammatory agents and have so much other, like we cannot say that she is the main cause behind her problems. If she is having some hormonal or other changes which are complicating the disease conditions, that can be okay. It's according to doctor's level of understanding.
No, you can say this is not hard and fast rule that steroids are will not damage the body.
Yeah.
We can never say. Yeah. Please.
In your presentation, you point out the topic of inappropriate use of medicine. What do you mean by that, and how it can be dangerous for us?
Very good.
His question is about inappropriate use of medicines.
Okay.
And there you can say that harms on our
Very
body.
good. The harms due to this inappropriate use. Yeah.
Inappropriate use of medicines means that one person is taking some medicines which are not according to his or her disease conditions and his body requirements. For example, if you are feeling stomach pain and you have taken omeprazole 40 mg per day, and you are feeling better at some stage, but according to our rules or protocols, at initial stages like stomach acidity or irritation, 20 mg per day is enough. 40 mg is dose for another condition, for another complication. You will not feel the harmful effects of the excessive doses at early stage. You will feel when you will make the habit of taking that dose at regular intervals. Whenever you feel some problem, you will take the excessive dose, which will result in effects of that dose on other body organs.
Thank you.
We see in many colonies in our villages the men who have done only we can say B pharmacy or the clinical assistant diploma of clinical assistance, and which period is only 14 months. So what do you think about they are treating in our colonies, in our villages as like a doctor, and they are giving medicines?
What's the question, please?
His question about the role of you can say drug regulating agencies on the irregular or unauthorized practices of quacks and lower level graduates or trainees.
That is your question?
Yes.
Sure. Please answer from your side.
It's a common trend in our society that whenever you go in some village or some town or colony, there is trend that a practitioner or a quack is there having their own clinic and line of patients, taking their advices from the person, but this is totally illegal or unauthorized. That if we also study ethics, if we go on that aspect, even towards the, irrespective of the laws, in ethics we study that if you don't have the proper knowledge about something, you cannot practice it.
True.
You will be accountable for your acts related to that matter.
True.
So simply this is a unauthorized practice, and the society can control these type of acts by ignoring their presence.
So how can we educate the society that this is their duty, to control all these things, that irregular practices, unethical practices which are going on in the villages, in the towns and small areas of the country. So how can we educate the society? Any idea from your side, please?
So it is mainly a complicated topic. As
This was the pucha.
it has a lot of reasons behind that. The first is our poor socio-economic status, which compels patients to take advice from that uneducated or untrained personnel. And on the other hand, there is role of drug inspectors controlling that area. Unfortunately, they are just taking their we can say monthlies, briberies from the respective persons, and they are quite that what is happening in society, they don't care about that.
Now I will be asking everybody, what's your concept of socio-economic? Because she was talking about this. She mentioned 2 times, in our talk, and during that her first answer, and socio-economic conditions. What is meant by socio-economic? Everybody that. Keep thinking about that. I will be asking you, what is meant by socio-economic condition of the society, socio-economic condition of the family, socio-economic condition of the country? What is that socio-economic? Please.
Antibiotic medicine is harmful for our health.
What's the question?
His question is about is antibiotic medicine has harmful effects on our life?
Very good. Please.
No, you can say that these are blessings if you use them in appropriate manner. If someone has infections, someone has a surgery, all of our disease conditions are related at some point to antibiotics use. So they are, you can say, blessing of Allah, but our illegal and inappropriate use has restricted their use.
And you have discussed all these things in detail, I think, during your previous talk, that if the doctor asks you to use antibiotics for 3 days, so even if you recover after first dose, but you are required to follow the prescription. And I think I do remember you gave in detail answer to that. Please, question.
Other big reason you have already mentioned that for drug addiction is bad companies and bad friends. I also noticed this in my surrounding. Lots of people have bad companies and bad friends who involve them in these things. Their parents failed to convince them to leave those companies and to leave those drugs, but they have not convinced by them. So how will you convince them?
Could you please paraphrase it? It's a really very impressive questions.
He's asking about the convincing power or convincing role of a healthcare provider in the matters of drug addiction. When parents fail to convince someone that try to get rid of this habit. So what is role of healthcare provider?
See, what a question, really, the most important question. See, that there is a drug addict. Now, and that drug addiction is due to the bad company, due to bad habits. Parents try to convince the child, they fail. Now that in making the child leave that company, in making the child leave that drug. No such a case comes to you. How can you, the health care provider, how can you do the thing which the parents can't do? Excellent. Please.
The healthcare provider should arrange counseling sessions with the gap of some days, and first of all he will try to at the level of that patient that what are the reasons or what are her or his likes and dislikes. When we go at that level of patient, he will feel that he is in a friendly environment. After that, it's very necessary to convince patient to get rid of this habit. And the other role will be of friends and society. If the friends or the company is bad, they cannot provide the same facility. The role will be of family, that they should not get back towards that our child is having these habits on a rigid basis or strictly basis, so we are failed. No, try on a regular basis, but give him a space to think about the matters. If the person is having some awareness related to that matter, and because there are some, you can say, attacks during the sessions, patient feels that he is going to die, and whenever he is at that moment, he tries that he starts taking that medicines again and again to fulfill his requirements. So the role of health care provider as well as family is at that stage. Try to give him the environment, or try to calm the person with other things that he likes. For example, try to convince him that we will have some rewards for you, and some picnic, travel,
and so on. Please, again, this is very difficult point. I can understand. No, nice, very poor. Really, the most impressive question was by Mr. No, that starvation. That the work which the parents can't do, how can the healthcare taker provide? What a question! But there is no that jadi, and then that jadi, and then that, you know.
No, sir, there is proper environment. You can't say that a patient is having bad habits, and you can get rid him of that habits within one day or within an hours. It's a matter of try at long term basis.
True.
You cannot get results
I agree.
within days.
Just a minute, please. Just a minute. Thank you, better.
Nowadays, many people buy medicine from any medical store without follow the instruction of doctor. So what is your opinion about this?
People visit the medical store. Paraphrase, please.
I think this question has already been asked.
No, this question little bit different. The people visit the medical store and they have no description with them. They simply visit the medical store and ask, that give this medicine, give that medicine, no, I need that medicine, and that medicine is given. It is happening only over here in our country. In rest of the world, what happens, that without prescription medicine is not given. You can never even have that simple paracetamol, what are we having over here? Ponstan, never.
Unfortunately, our law enforcement agencies are unsuccessful in this matter, as there are rules according to laws and protocols that a certain number of medicines will be provided for self-medication, and the others will not be provided. But it is a matter of preferences that our medical store persons try to sell more medicines, and they are not following the rules according to protocols or according to conditions set by drug inspector or the other persons. On the other hand, the patients are also unaware the effects of those medicines if they take in excess or reduced doses.
Thank you. Please, question please.
You have used the term antimicrobial. What is this? Can you explain?
Yeah.
Antimicrobials are a wide range of medicines having different classifications related to antifungals, antibacterials, and antiviral. And anti-amoebics. You can say that a range of living organisms which are infecting persons in different manners. The medicines are classified according to their susceptibility and their types.
Thank you. The last question.
What do you think about when we should take medicine?
That what is that stage when we think, oh, no, this is the time to consult the doctor, this is the time to visit some clinic, this is the time to visit some dispensary or some medical store and buy medicine or take medicine? Please.
You mean that the level of disease or complications?
Yeah, what I could understand. This was the point.
The criteria will depend on from disease to disease.
Yeah.
As many diseases have severe complications which we will face at early stages. But in my opinion, whenever you feel something is unusual, and it can lead to some serious effects. As we are living in a vast majority of persons, and we are listening that every day that something is happened with someone, but he failed to come to the doctor at appropriate time. So due to lifestyle changes and other habits, the diseases are more, you can say that, complicated due to lifestyle patterns are also changed. So according to me, everyone should consult a doctor at early stage, that whenever he feels that he has some inappropriate health conditions.
Yeah. So it varies.
It varies
disease to disease. It varies now from lifestyle to lifestyle. No? And what is the standard that when you feel that this behavior is unusual, it doesn't happen like that in routine. It is happening in a different way.
And it is prolonged.
Yeah, and this unusual behavior, it gets prolonged. So now this is the time when you should think of consulting the doctor, visiting the hospital, know that going to some clinic and taking some medicine. Thank you. The last part.
As I am engineering student, so I came to know about medicine and drugs, etc. in today's session. I came to know about antibiotics.
Okay.
How to take antibiotics regular or take 1 or 2 days.
Okay.
And microbials, that was my question.
Yeah.
And other points raised by other students.
Okay.
It was that if we...
Sorry, better. Please, Tabish.
I boosted my confidence for asking questions.
Yeah. So that was the point. Now, that this session was very fruitful for you. It was very beneficial for you in this context, that it enabled you to develop your confidence, to boost your confidence. Now, please.
It was very nice, mashallah. Question I asked, I cleared my doubt which I have on the illegal, we can say, doctors.
The point where you learned.
I really know about the use of medicines with its presentation, and how to use medicine in a appropriate way.
The point which was new to you, and it is very helpful, it is beneficial, it's fruitful for you. That's the point.
Today's session is very helpful for me.
So 2 things, know that it resulted in boosting your confidence, and second, know that gave you some idea how to ask the question.
Yes.
Please.
I came to know about the uses of omeprazole because I read on many medicines written on the outside of the cover of that medicine. But I don't have knowledge about that medicine. Today I came to know about the uses of that medicine.
Because the way she explained, it that made Mr. Ahmed Ali understand the true meaning of that the terms which are written there, medicine. Yeah.
I learned it is dangerous for everyone to take medicine without the prescription of doctor.
Excellent, beta. The best point, that taking medicine without prescription by some expert, I mean some doctor, qualified doctor, Excellent. Now that if you don't do that, it shall be harmful. It shall be dangerous. Sometimes it can be fatal. It can cause death. If we take medicine now without no description by some competent doctor, qualified doctor. Please.
Her presentation was very amazing. I learned a lot of things, but one thing which I learned, that if a person is suffering from a drugs, how he comes out from this disease.
That was a great idea which she gave. True. How can know that we can come? God forbid, if any one of us suffers from that, how can we come out from that? Or if someone else is suffering in our society, in our community, how can we know that, bring that person out of that condition or situation? Great.
I learned about uses of antibiotic medicines.
Any one point about that medicine, please.
Don't take medicine without the description of doctor.
Excellent. That was the point. No, please.
I learnt about the difference between rational and irrational use of medicine and the class of medicine like steroids and antibiotics.
Excellent. What's the main difference which you learned between two medicines you're talking about, the two classes?
If we use medicine according to the doctor instructions and time limit or prescribed medicine, that is a rational use. And if we use medicine for self isolation, so that is irrational use.
So the difference you came to know today about that, the rational use and irrational use. And rational use, she says, but I don't know whether she's right or wrong, that rational use is the use of medicine according to the prescription by some competent doctor. Irrational use is the use of medicine without prescription first, or if it is prescription but that is not prescribed by some competent doctor, right?
To some extent.
To some extent. What's the exact difference, please? Exact difference now. Please.
It means that appropriate patient, appropriate medicine at right time, right doses, and administered in right way.
Excellent. No points clear, beta. So not only the prescription by some competent doctor, but there are that again prescription includes all these things.
No, sir.
What do you mean by that?
Whenever a doctor prescribes a medicine, it's a trend of our society that he does not counsel in a proper manner. He just write there 1 + 1 + 1 in that manner. Name of medicine and how can a number of times taken.
Please.
As I am the part of medical team, I came to know the different views of non-medical person about medicine, and also I came to know many things related her research regarding medicine and their rational views.
Excellent, beta. Thank you, Ji.
Well, today's session was really beneficial for all of us, and I came to know that we shouldn't take antibiotics without prescription.
Excellent, beta. True. Please, his son.
Today's session was very helpful about the knowledge of by the using of irrational medicine and taking the drugs.
Excellent. Please.
I came to know about the illegal factors that connected with medicines, like without prescription, a medicine taken from a pharmacy, and the doctors that are seated in our societies without with low qualifications.
Please.
This session was very useful. I came to know that if doctor recommend you more steroid for more days, it is better for your health. So we not argue with the doctor. And one thing, if we feel any change in our body or anything, we must visit a doctor. Unusual change.
Unusual. Nicht high on the do only and again I the pan on the pian. Again sir severe on the shami the or the puri dehar of the unusual. What I could understand. Please, Junaid bet. And now Kamran.
This session was very helpful for health care, and I came to know that steroids are not harmful in all the ways.
If prescribed by some competent doctor, competent, sincere, a real professional doctor.
And pharmacies should not be allowed to give medicine without the prescription of the doctors.
That is the point now. If only one step is taken, if they are made bound now to give medicine now at prescription by some company doctor, the rest of all the things will get settled. No? So please
avoid from the irrational medicines.
Which medicine he needs? You spent no more than 1 hour over here at the dais today. Let me know the difficulties which you faced over here in this environment, so that we can remove those hurdles, so that we can make some arrangements in order to facilitate the presenters who are going to follow you. Please, the difficulties which you faced today.
I did not face any difficulties.
Okay.
The session was very fruitful, and the audience was also very cooperative and attentive, and they realized me and encouraged me in so many ways that I am performing well.
Thank you very much. See you tomorrow, inshallah.